Good evening, everybody. We're back with Bread and Butter Primary Care. I'm Dr. Stokes, and today's video is entitled Diabetes, What is the A1C? So the hemoglobin A1C is a lab measurement that we use to monitor and diagnose people with diabetes. There's a couple different ways to check the amount of sugar that is in your blood vessels and floating in your blood. One is just to check it straight up, a glucose sugar check, and that's what you do or patients do when they prick their finger and they get the strip and then they put it in the glucose machine and it reads out a number. That's the amount of sugar that's just floating in the blood. So usually in a person without diabetes who's fasting, that'll be between 80 and 100. And if people have diabetes, then it will be higher than that. Now, the issue with what that's called a random glucose, because you're just checking the sugar at a random time. It goes up and down with what we eat. And so even a person without diabetes, if they've recently eaten, it could be high. And so it's hard to use a single random blood sugar to help all that much. And so then what we do is we use the A1C, the hemoglobin A1C, which is a measurement of the amount of sugar that's connected to the red blood cells. Okay, so what happens is your bone marrow makes blood cells, and red blood cells live in the body for about 3 months. So they circulate for 3 months, and then they die, and then new red blood cells are made. And when you have sugar in your blood, part of that sugar sticks to the red blood cells. So some of it is free floating, so it can go into the cells and feed the body. Other parts of that sugar are actually stuck to the red blood cells. And so when you go to your doctor and they get an A1C or a hemoglobin A1C, they're measuring the amount of sugar stuck to the red blood cell. And since red blood cells live for 3 months, it gives a sense of what the blood sugar has been on average over a 3-month period. Because some of that, if you take that blood sample for the A1C, some of those blood cells have been floating around for 3 months. And so they were exposed to the sugar levels 3 months ago, 2 months ago, and currently. Some of those blood cells have only been alive for a couple days, and some are in between. And so you can get that. So if you had really high sugars 3 months ago, and then they got kind of lower, and then now lower, an A1C averages those three together. And so we can say over the last 3 months, your blood sugar on average has been blank. Now the numbers are different, and so A1C goes anywhere from like 4 all the way up to like 15 or 16, generally speaking. And so an A1C of 7 is about a blood sugar average of 150. And so it's a better number to monitor how someone is doing with their diabetes because it gives you an average. So someone can come in, we check their A1C, and let's say it's a 9. We can put them on some medicine, give them some lifestyle advice or changes, and then they implement those. After 3 months of that intervention, we can then check an A1C because 3 months have gone by. So when we check that blood sample, it's going to be an average of the sugars since we implemented intervention A, whatever that intervention was. And then we can see, okay, you went from an A1C of 9, down to an A1C of 7. So the A1C is something you're going to hear, especially if you're diabetic, tossed around a lot as far as checking your A1C, knowing what your A1C is. So that's what it is. It's a measurement of the blood sugar that gives us an idea of what your sugar has been over a 3-month period. Very useful to diagnose people with diabetes, as well as to monitor their progress as we begin to treat their diabetes. So that's what an A1C is. I hope that's helpful, and I hope you guys have a wonderful night.